live now to Ottawa, where the government is announcing details of its new dental insurance plan. Let's listen.
As Parliamentary Secretary to the Minister of Democratic Institutions, he has been a staunch advocate of marriage equality rights and played a key role in helping to reform Canada's animal cruelty laws. Dans ses fonctions publiques et privées, le ministre Holland a appuyé des initiatives liées à la
initiatives have been taken in healthcare.
Director of the Heart and Stroke Foundation of Canada's Ontario Mission, as well as its National Director of Children and Youth, and helped to secure funding for Grandview Children's Center's future Ajax location. Mesdames et messieurs, veuillez vous joindre
Ladies
à moi
and
pour
gentlemen,
accueillir sur la
please
scène
join me in
Valérie
welcoming to the
Réal,
stage my
Ministre
colleague,
Holland.
Minister Holland.
Merci beaucoup, Mona. C'est un grand plaisir.
Thank you, Mona. It's a great pleasure to be here for such a historic day. From the outset, I'd like to thank Jean-Yves Duclos for his extraordinary work as the former Minister of Health. In a few moments, I'm going to talk about our relationship. Also, I appreciate Don Davies very much. I'd like to also thank the entire team at Health Canada, especially Lindy, Steve, and all the others for their hard work. It's extraordinary, and this would not have been possible without their hard work. Thank you for that.
Algonquin College as well, and to welcome our oral health care partners to what is a truly monumental day for health in Canada. It's transformative. A third of Canadians today do not have access to dental insurance through their employer. 1 in 4 have said they were unable to visit an oral health professional because it was too expensive. And let's talk about what that practically means, because oral health is health. When somebody doesn't get the oral health care that they need, it means they're going to have issues cardiovascularly, it means with diabetes or a myriad of other chronic disease and illnesses. So it isn't just about the social justice of somebody being able to wake up and go to work with a healthy smile. It's fundamentally about their health. As Minister of Health, I'm deeply proud that Canada has one of the best health systems in the world. But we know we can do better. We know we can have the best health system in the world. And today is a monumental step in that direction. Today, we're here to share with you the details of the Canada Dental Care Plan and what it means. Up to 9 million Canadians today do not have dental insurance. This Action Day will help support them to get the access they need to oral health care they need and deserve. Far too many people have avoided getting the care that they need simply because it was too expensive. And that's why this plan is essential. With the Canadian Dental Care Plan, they won't have to anymore. It's going to help make life better for eligible Canadian residents because they won't have to make the choice between paying their bills and getting the care that they absolutely need. The Canadian Dental Care Plan will cover a wide range of services for Canadians. It will cover preventative, diagnostic, restorative, surgical, among other services to ensure their smile is healthy and joyful. These include x-rays, fillings, root canal treatments, and dentures. You know, to put it in a really practical term, and I've had this experience a lot, and I had an opportunity to talk with Seamus because this is going to mean so much for seniors, but to put it in practical terms, I was at Spencer House in Nova Scotia, and I was talking with a group of seniors who said to me, Mark, this isn't really going to happen. I've had the same dentures for decades, literally, and I don't have the money to replace them. And when I said, no, this is real, it's going to happen. One of the most powerful moments for me politically, you know, in my political life, to see that look of optimism and joy and what that dignity would mean. The dignity of being able to get those dentures replaced, of getting the oral health care that they deserve, what that meant to those people's lives. I know, Seamus, you're going to talk about that, but it was deeply touching and powerful to me. You know, speaking to oral health professionals who are devastated because they have to wait, and I'm looking at Heather and the conversation, Heather, you and I had, about people who can't get the care they need, and so they have to wait till their situation deteriorates so enormously that they have to go into an emergency room and get it done with as an emergency at enormous additional cost, not just to our health system, but to the dignity of that person, having to wait until their health situation deteriorated to that state. And that's why I want to take a moment to address our oral health professionals. I've met with many oral health professionals, and I know they are passionate, deeply passionate, about providing the best health care for Canadians. I'm excited to be launching this new program for Canadians, knowing that we have such a committed group of oral health professionals working in all communities across this country. We've got a lot of work to continue to do as we move forward to starting this program. They've told me that they worry about people who don't have access to oral health care, and they know that better than any of us, the importance of enabling Canadians to not only get what they need to improve their oral health, but to ensure that their oral health is taken care of. Because when people don't have access to dental care, as I mentioned, they have to go to an emergency room. That costs millions of dollars to Canada's healthcare systems, and it's a fundamentally unjust outcome. This isn't just about helping Canadians access the care that can improve their oral health. It's also about building a stronger overall health system for Canada, about coming from health in every direction. With a plan that will help so many people across this country, we want to make sure this is a smooth and positive experience for Canadians. That's why we're going to be opening application in phases, starting with seniors and then people with disabilities, children under 18, and then ultimately by 2025, all eligible Canadians. This week, we're sending invitations to apply letters to seniors 87 and older. Once they are enrolled, seniors will be able to access oral health care as early as May of 2024. Every month, we will see more people be able to book their appointments with their oral health professionals. Look, this is a proud moment, I think, for all Canadians in expanding what is the definition of healthcare in Canada. I want to thank all of my colleagues for their extraordinary work to get to this point. The Canadian Dental Care Plan is a vital part of our government's plan to help Canadians get better health care and to make life more affordable. Avec ça, c'est un grand plaisir maintenant de présenter.
Now it's my great pleasure to present Minister Jean-Yves Duclos. Thank you very much.
Merci beaucoup, Marc. Merci.
Thank you very much, Mark, and thank you, Mona, for that kind introduction. Good morning, everyone. As we know and have heard, dental care is essential to overall health. Good health and oral health play an important role in the prevention of cancer, diabetes, respiratory illness, cardiovascular disease, and brain disease. The dental care report can lead to more costly care for general deterioration of health conditions, loss of sleep, repeated absence from school and work, especially for those in lower income brackets. But far too many of those people cannot simply afford dental care. About 1/3 of Canadians are reluctant to consult an oral health care professional simply because they do not have the insurance money. We can and must do better. You'll probably recall that in December 2022, Prime Minister Trudeau announced the first phase of our plan to improve access to dental care by launching the Canadian Dental Care Benefit that would give eligible parents direct payment to help them cover dental care costs for their children under the age of 12. To date, around 395,000 children have benefited from this plan. But that alone is the only way to be able to provide affordable dental care.
Mark already mentioned, and I would again mention the very hard work and the strong collaboration of Don Davis from the very start of our collaboration to deliver on our commitment to improve access to dental care services and make life more affordable for Canadians. As former Minister of Health and the current Minister of Public Services and Procurement, I am very grateful to be here with my colleagues to announce the next steps in the rollout of the new Canadian Dental Care Program. Public Services and Procurement Canada led an open, transparent, competitive, and multi-stage procurement process to select the third-party administrator for the plan, which will begin rolling out by early 2024. Following this robust process, a contract valued at more than $740 million was awarded to Sun Life Insurance Company of Canada to take the helm of this important initiative. An early work agreement, awarded on September 6, 2023, allowed Sun Life to undertake the necessary preliminary work to ensure the timely launch and the successful implementation of the Canadian Dental Care Plan, while the details of the main contract were being finalized. Thanks to a competitive and agile procurement process, today we are even closer to ensuring all Canadians have access to quality dental care. In fact, as was mentioned, applications for membership in the Dental Care Plan will begin to be accepted this month. En raison du potentiel de forte demande pour
Given the potential of strong demand for this plan, we will be proceeding in stages, starting right away with seniors. It will be a simple and direct process. Invitation letters will be sent by age group, starting with those over the age of 70. Then we will be proceeding with other age groups by March. Letters will be sent to all seniors who are eligible with instructions on how they can validate their eligibility. Seniors who receive an invitation letter can call Health Canada and simply have to answer a few questions. By May 2024, an online portal will be accessible to all of those over the age of 65. Supporting those who are vulnerable and seniors is just the beginning. Eventually, a larger number of Canadians will be able to sign up for the plan. Given the financial obstacles, the Canadian Dental Plan will help some 900 million uninsured Canadians receive the dental care they need. This is one of the most useful government-funded dental care programs. To conclude, no one should have to choose between their health and paying their bills. We should not have to be guessing a person's income by the quality of their smile. Regardless of their economic status or situation, every Canadian should be able to receive the essential oral health care they need. We will continue to be there for those who need it the most by making life affordable and creating a more just future for future generations. Thank you very much.